Hello, my name is Dr. Alicia Fry, and I am going to demonstrate aseptic technique for blood culture collection in the field to diagnose Salmonella Dublin in calves using minimal restraint and basic supplies. The authors have no conflicts of interest. I would like to acknowledge the dairy farm that allowed the videotaping of this procedure on a sick calf. Salmonella enterica subspecies enterica serovar Dublin, also called Salmonella Dublin, is multi-drug resistant, zoonotic, and the host-adapted serovar in cattle. The main clinical presentation on dairy farms is septicemia in young calves, resulting in high morbidity and mortality due to the lack of response to labeled antibiotics. Calves develop fevers that typically range from 104 to 107 degrees Fahrenheit, tachypnea and depression, and often die acutely. In this video, a 5-week-old dairy calf is demonstrating respiratory distress and depression. This calf later died, and Salmonella Dublin was cultured from the lungs. Occasionally, seizures are present due to meningoencephalitis. Pregnant cattle can abort, and rarely cattle of all ages can develop diarrhea. A blood culture is currently the gold standard to diagnose Salmonella Dublin ante-mortem in bovine neonates presenting with the clinical signs described. Blood culture media must be used and can easily be contaminated by environmental bacteria during collection and inoculation. In this demonstration, the VersaTrek blood culture media is used, and the aerobic bottle is labeled as such and called No. 1 Easy Draw Blood Culture Bottle. Anaerobic blood culture media should not be used. The volume of blood inoculated into the bottle can range from 0.1 to 5 milliliters depending on the size of the patient. For neonatal calves, 2 to 3 milliliters is the ideal volume. Blood culture media should not be refrigerated or frozen. Ideally, it is stored in an incubator at 98 degrees Fahrenheit, but for field veterinarians shipping to a veterinary diagnostic laboratory, storage at room temperature is adequate. First, assemble the following supplies: regular latex gloves, clippers, solution for a surgical prep, in this case chlorhexidine 2% scrub and 70% isopropyl alcohol, along with dry gauze, are used. 1 pair of sterile gloves, a 6 milliliter syringe, 2 needles, and 1 No. 1 Easy Draw blood culture bottle brought to room temperature. The paper in the sterile gloves will serve as the sterile field once opened. A clean tote to carry all supplies is helpful. Ice packs at room temperature to package around the blood culture vial to minimize dead airspace and insulate the vial so it does not get chilled in transit, and a diagnostic laboratory submission form in a Ziploc bag. In this video, the calf has a fever of 105 degrees Fahrenheit and can be restrained while standing by the on-farm personnel who has experience handling calves. A large area on the left side of the neck is clipped, and then a surgical prep is performed with 2% chlorhexidine antiseptic and 70% isopropyl alcohol alternating. It is important to get the skin as clean as possible to avoid contamination of the blood culture media. After completing the prep, the assistant is careful not to touch the sanitized area. The veterinarian opens the sterile glove package and drops the syringe and needle onto the paper now serving as the sterile field, then puts on sterile gloves and attaches the needle to the syringe. She approaches the calf and punctures the jugular vein. Note, only 2 to 3 milliliters are required. Extra volume can cause misreading on the automated blood culture machine. Then she uses an alcohol pad to disinfect the rubber stopper on the blood culture media and changes the needle on her syringe to avoid contamination during inoculation. While she is changing the needle, the rubber stopper has time to dry. Then she inoculates the blood culture media and inverts it several times for thorough mixing. The blood culture bottle is labeled with the calf ID, farm name, and date and time of sample collection. It is placed in bubble wrap and then placed in a styrofoam box inside a cardboard box for overnight shipment to a veterinary diagnostic laboratory. Room temperature ice packs are packaged around the blood culture bottle. A completed submission form is placed in a clear plastic bag to protect the form from getting wet. Then the box is sealed.